Welcome back to HIP, Health Insurance Personalized. It's also known as a consumer-driven healthcare or demand-controlled healthcare. So where the consumers are empowered under the personalized health insurance. Now, today's topic is quality of care. Let's talk about it. This is Consumers Doctor on behalf of Foremost Organization. Let's talk about quality of healthcare, which starts with quality health insurance. It starts with quality health insurance. Personalized health insurance means easier access to quality care. Easier access to quality care. Easier access to quality care means better treatments. Yes. Better treatments means better health. Yes. The Institute of Medical Medicine concluded that health insurance is associated with better health outcomes for adults with their receipt of appropriate care across a range of preventive, chronic, and acute care services. Acute care services, folks. Adults without health insurance experience greater declines in health status and die sooner than do adults with continuous coverage. The ripple effects of being uninsured and having poor health are felt throughout the society. The uninsured children have impaired development and poor school performance. Uninsured children are 70% more likely to go without care for common childhood conditions like asthma, ear infections, sore throats. Simple. It's uninsured children are five times more likely to have unmet need for medical care each year. The uninsured are 33% less likely to get a routine physical examinations and 25% less likely to visit a doctor for an illness. Uninsured women are 36% less likely to get a pap smear. Yes. And 60% less likely to get a mammogram. Uninsured men, 40% less likely to get a prostate examination, folks. Uninsured adults have more absence from work and more unscheduled sick days and greater rates of disability. 2004 Kaiser Family Foundation study found the societal cost of uninsured could be as high as $125 billion. So quality of care includes good mental health care for individuals and small groups. 2008 Mental Health Parity and Addiction Equity Act, so-called MHP AEA, required employers with over 50 employees to cover mental health the same as a physical health. Mental health, same as physical health. Employees and the family members enrolled in small group plans need the same integrated mental health benefits, folks. Same integrated mental health benefits. One truism exists. One truism exists. If an employer sponsored plan does not include stress management, you can be 100% certain that plan members will have their own stress management program. It is unlikely, it is unlikely to be beneficial to a worker's health or productivity. Workers' health or productivity without a structured stress health management program. Most common self-destructive self-destructive stress reliefs are comfort foods, smoking, alcohol, and the drugs. That is a common problem in stress management program, and most employers are beginning to understand, they are beginning to understand the work effects of stress and depression. Few employers fully grasp the debilitating impact on families from attention deficit disorder, so-called ADD, or post traumatic stress disorder, PTSD, and other more complex mental health diagnoses. The costs, the costs for mental health conditions are enormous for employers. If you categorize into the lower cost, simple mental health conditions like frustration, anxiety, low stress, minor depression can lead to tobacco use, sleeplessness, common colds, blood pressure problems that can lead to increased errors and also loss of teaming with fellow employees. So that there is a even minor mental health symptoms can cause the productivity in the company. What are the medium costs? Symptoms including like moderate stress, depression, anger, ADD, attention deficit disorder, and post traumatic disorder can lead to hypertension, musculoskeletal, digestive, and gastrointestinal problems, folks. Gastrointestinal problems that can cause corporate productivity costs to have more absences, poor morale, relation conflicts, and lost productivity for the companies. What are the high costs? Well, high stress, major depression, schizophrenia, bipolar disorders, obsessive compulsive neurosis, panic disorders, anorexia, bulimia can lead can lead to physical conditions like cardiovascular problems, cancer, diabetes, asthma, back pain, and alcoholism, which ultimately will affect the corporate productivity as a result of low productivity, divorce, turnovers, early retirement, workers' comp, and disability. Yes. What are the extreme extra high costs? Like if you have a, if extreme high costs are like violence and suicide, which can lead to accidents and burns, and ultimately leads to death, work violence, and disaster recovery, folks. This disaster recovery. So ultimately, it affects the production. Mental health issues are not character weaknesses, folks. They are not character weaknesses. Like most physical illnesses, mental health is a disease and is treatable. And is treatable. As uh, mental health of America axiom states, you cannot have a health without a mental health. That's so true. You cannot have health without a mental health. You cannot have an access to quality of care without access to affordable health insurance. Access to good health insurance that meets the unique needs of individuals will provide access to personalized quality of care. Personalized quality of care. Remember, quality of care goes beyond credentials and medical results. It, it encompasses timely medical advice, informed options, alternative treatments, and good bedside manners, and more, and more. So quality of care is only possible when options to access is provided through affordable health insurance. Personalized health insurance does add does focus does factor in quality of care because consumers are empowered in this whole thing. When consumers feel they're not healthy, they get to access a quality of care. Folks, thank you for listening. This is Consumers Doctor on the behalf of Foremost Organization on personalized healthcare, focusing on quality of care. Quality of care. We will see you in the next episode. That's going to be cost of care. Thanks again. We'll see you in the next episode.